Hey everyone, welcome back to another episode of The Political Patient. I'm Shreyas and I'm here with Danusha. Today we're going to be talking about an antibiotic called Temocillin. And Temocillin is actually not necessarily a new medicinal advancement. It's a drug that's existed for a while, but it's been often forgotten about. And a new scientific study out of Sweden is actually reminding everyone about its efficacy and how it might be a better drug to its alternative of cefotaxime. And so cefotaxime is typically an antibiotic that is administered in people intravenously when they have urinary tract infections. And the biggest cause of urinary tract infections are the E. coli bacteria just being found there, and they shouldn't be there. And that can cause issues, and you need to, I guess, kill those bad bacteria, obviously. But what ends up happening is when you typically, or what we've been seeing is that when physicians administer cefotaxime um, into the patients that are struggling with urinary tract infections, it does not selectively um, kill the bacteria that needs to be killed, and typically the E. coli that are found in the intestine, so the intestinal bacteria are affected, and they end up becoming very resistant to cefotaxime. And obviously, antibiotic resistance is a huge topic in today's medical literature, just because of various different things of like antibiotics becoming less effective over time, and just how many healthcare professionals are almost inadvertently requested by their patients to administer these or prescribe these antibiotics, even though they might not be the best course of action. So it's been in the news for a while, but specifically we want to talk about this. So an alternative to cefotaxime seems to be Temocillin, um, and this drug seems to be almost just as effective and have the same like few side effects of using the drug. But the big thing is that your intestinal bacteria are not necessarily affected when this drug is used for urinary tract infections. So yeah, Anusha, did you want to share anything in particular?
Yeah, I think it's important to state that antibiotic resistance is something we don't really think about in terms of like when you're going to the hospital and you get like, for example, like a shot of like penicillin, like you're grateful that obviously it's there, but like no one really thinks about what happens if the bacteria that it actually is trying to kill are not actually being killed, you know? I think a lot of people at the end of the day don't understand how powerful these antibiotics are. That's off the top of my head, the subtypes for penicillin, which is probably the one that most people know of, the things that it can be used to treat like meningitis, pneumonia, botulism. There's like I think what is it, like some like form of like strep sometimes too, diphtheria. There's like 1,000 different, like that's like going like off the top of my head. There's like I think anthrax too is like one of them, like it was like licensed to treat it. Just off the top of my head, those are the ones I can think of. I'm sure you could go look it up and see like dozens and dozens and dozens of diseases that are treated by it. So it's very important to note that like if we have drugs that are no longer able to effectively do their job, then we're going to see a lot of diseases that we previously thought were now treatable coming back with like a vengeance now, because now we have to develop a new antibiotic to target them. It's almost like a non-stop cycle of just playing catch up, which is something we don't want to do. Going back to this study though, it's actually really interesting, Shreyas, this drug that they recently discovered, something that they actually didn't really discover. Temocillin is actually something that has been around for a while now, and it's just kind of been forgotten in favor of like different drugs that have been more effective, right? Such as, for example, cefotaxime, right? And so it's pretty interesting that especially the Swedish government decided to do this study, especially considering that I believe it's Temocillin is only used in some other European countries. It's not even marketed in Sweden. So the fact that Swedish researchers were like, hey, maybe we should actually, take some time and like research this drug really goes to show that like, at the end of the day, we're going to eventually discover new drugs. It's just a matter of maybe looking back in our past to maybe like treat some future problems.
Yeah, and exactly. So on top of that, like if once more and more studies come out on the use of Temocillin and if it's really a good alternative to cefotaxime, I imagine that more and more medical guidelines would likely recommend healthcare professionals to use Temocillin as like a first course almost for like standard procedure. And this that it's just really the perfect example of showing how like advancements in science typically guide health policy and like different recommendations or restrictions that are made in the healthcare field, and things are always changing. Like um, as you mentioned, this was a more like a drug that's existed, it's been forgotten about, but might come back. So it's definitely very interesting. And the study that we're referencing in particular, they studied 152 patients with urinary tract infection and who ultimately developed a fever. And those individuals needed these intravenous antibiotics. So cefotaxime would have been used normally. I imagine, I believe in Sweden as well, because they don't currently sell Temocillin. But by using Temocillin, they saw that the intestinal bacteria was significantly less affected in the experimental group that uh, used that had the use of Temocillin.
Yeah, it's worth mentioning that temocillin is actually a member of the penicillin group of antibiotics, which goes again to show how powerful this group of antibiotics really are. And if we really just kind of look back and look at these new or old versions of these antibiotics, we really could see some new scientific advancements, especially where we don't expect to see them.
Exactly. And something else that caught my eye when I was reading this for the first time is that this study was actually funded by the Public Health Agency of Sweden.
Mm-hmm.
So the Swedish government did play a role in the development of this study,
Mm-hmm.
which goes to show how government action and different like health policy initiatives can actually inspire different studies to even be developed in the first place, which can then go back and inform different policies that you may not expect to have needed modifications or changes.
Yeah, absolutely. Like obviously there are like as long as the researchers were following their proper ethical guidelines, as long as they were, doing what they needed to do in an unbiased way, sometimes the power of the government behind your study and having the power of a very, robust public health system and public health agency really can do quite a bit for your study and just moving it forward and finding these new scientific advancements.
Agreed. Well, that's all we have for today in the episode regarding Temocillin. Thank you so much for listening to us, and we hope you catch another episode of The Political Patient.